For many of the years that I've practiced general surgery in Seattle, Dr. Stan Herring has been the go-to guy for me, my patients, my family, and I keep thinking, boy, if I couldn't operate any longer, I'd want to be a physiatrist if I could be half as good as Stan Herring. This is a fellow who practices the very finest of physical medicine. Physiatry is got a little bit of a naming problem. So everybody says, what's a physiatrist? Well, physiatrists, some people call them rehabilitation specialists or a rehab doctor. But truly modern physiatry has taken physical medicine to a whole nother level, and Dr. Herring is truly at the top of his game. He's the medical director for the spine care at the University of Washington. He's a clinical professor in the Department of Rehabilitation Medicine, Orthopedics and Sports Medicine, and Neurologic Surgery. He's really the brain power, if you will, behind our very active and busy spine surgery program and team at Harborview. He serves as one of the team physicians for the Seattle Seahawks and the Seattle Mariners, and is a consultant also for UW Sports Medicine. He's a board-certified physiatrist who's been in practice for over 25 years. And his practice focuses on diagnosis and management of the neurological and musculoskeletal injuries, particularly spinal disorders. How many of you in the room, either yourselves or your immediate family, have had back problems? See a raise of hands. It truly is, along with the anterior cruciate ligament, one of the design flaws of the human body. Well, there's nobody better in the Seattle area in making the diagnosis and figuring out exactly what you've got than Dr. Herring. He also treats a lot of other sports-related injuries, particularly concussions, people who lose consciousness in the course of an injury or sports. He's held many national leadership positions, including he's been the president of the North American Spine Society, a member of the Board of Trustees of the American College of Sports Medicine, and a board member of the Foundation for Physical Medicine and Rehabilitation, his primary specialty. And he's also a founding member of the Physiatric Association of Sports, Spine, and Occupational Rehabilitation. He serves on the editorial boards of professional journals and has been an editor of 6 textbooks, as well as a contributor to over 20 professional journal articles and 40 textbook chapters. So it's a real pleasure that I get to share with all of you tonight my dear friend, my physician and colleague, Dr. Stan Herring.
It's a great pleasure to be here tonight and talk about sports medicine, a big part of my life. It's a great position, it's a great fun. It's not, however, without controversy. And tonight I thought we would pick a topic where there is controversy, concern, as it relates to sports. And I could think of no better topic than concussion. It's hard for me to imagine that all of you in this room are not aware of articles in the newspaper, comments in the press, who goes back, who doesn't go back, when is it safe, when is it not safe, when is it safe for a professional athlete, when is it safe for a child. One of the biggest challenges facing doctors like Dr. O'Kane and myself is this very issue, good issue to talk about tonight. I do have the privilege of being one of the team physicians for the Seahawks and the Mariners, but I am really only one of the very, very important team, our certified athletic trainers, orthopedic surgeons, primary care doctors. It is really a group effort, and I would be remiss if I did not acknowledge my colleagues who help me, support me, teach me, and make my capacity to care for the athlete much better. A lot of players get dinged. Happens all the time. Sometimes a ding is a ding, and sometimes it isn't. And not just in football, in other sports as well. It's a pretty big part of sports, particularly sports that are collision sports or contact sports. It happens every game, many times in practice. Sometimes it's okay, and sometimes it's not. This is a nice video shot of one of my favorite patients. right here. Very good athlete. High school, good athlete, never lost consciousness. Bad concussion or not so bad concussion? They're all different, they're all unique, and we'll talk about this a little bit later. What is a concussion? Do you have to be knocked out to have a concussion? Do you have to lose consciousness? Well, concussion, or what we call a mild traumatic brain injury, is what's called a pathophysiologic process, meaning it usually kind of messes up the physiology of your brain, not the anatomy of your brain. And you can get it by hitting your head on the floor or hitting another part of your body and having your head rattled around. Commonly, there's a rapid onset. This is not a subtle diagnosis. Something's usually wrong after a player is concussed. And these impairments are usually short-lived. Transient confusion, disorientation, player comes back. The acute symptoms usually reflect just a short circuit. This is not blood in the brain. This is not a hematoma. This is sort of a physiological aberrancy. And the symptoms are really quite broad. And if you take nothing home tonight, but at this point, you do not have to be knocked out to have a concussion. As a matter of fact, the great majority of concussions do not involve loss of consciousness. A critical point to teach coaches, athletic directors, and certainly athletes. What happens when someone has a concussion? What is this physiologic disruption? Well, there's metabolic changes in animal models, and this is what we think happens in brain injury. What happens when you strike your head on that basketball floor is the cellular concentration of all these ions, potassium and glutamate and calcium, shift. You lose this sort of gradient of ions that you have in the cells of your brain. At the same time this happens, the blood flow to the part of the brain actually decreases, which is unfortunate because the way that you repair these ionic imbalances is to deliver glucose via the bloodstream to fix that problem. So you have a disturbance, and at the same time you have a disturbance, you have the decreased capacity to deliver the fuel necessary to fix that disturbance. And that is the mismatch. And this so-called mismatch in fuel supply and demand is probably why certain parts of the brain don't work after they've been concussed. During that time, the brain tissue is vulnerable. So while you're having all this ionic confusion, if you will, and decreased glucose, that tissue of the brain is vulnerable. It doesn't work well and it's vulnerable to another impact. And no matter what we've done in sports medicine for the last 100 years, nothing makes that better except for time. Can't ice your head. It doesn't work. There's no shortcut. The recovery is purely based on time. So you don't have to lose consciousness. You need glucose. It's not being delivered, and the only thing that makes that right is time. How common are concussions? Let's look at some college numbers. University of Washington's a major college. Looking at 16 sports over 15 years, concussion rates are reported to be up. 7% on average over 16 years of the study, so they're going up. We think it may be that there's really an increase, or it may just be that we're better now at looking for them, so-called detection bias. I don't know if there's an explosion of concussion or not, but there's certainly a better awareness of concussion. In this study, looking at the major NCAA colleges, there were over 9,000 concussions reported in that 16-year period. It's a lot of concussion. Not surprisingly, football had the greatest number. But you know what? They didn't have the greatest rate. You know what did? Women's ice hockey. This was only studied for the last 4 years, but in those last 4 years, women's ice hockey had the greatest rate of concussions. Well, maybe you should play women's soccer instead. But you know what? The rate of concussion in women's soccer was also quite high. The rate was greater than football. So this is not a football issue. This is a sports issue. So it's not a male issue or a female issue, it's both. And it's any sport where there's a chance for collision or contact. So for those of us who practice sports medicine, we have to have a plan for this. And our plan before the game ever starts is to have a medical day plan. So we need to decide what to do. If you're going to see a Husky quarterback on the field with a possible concussion, this is not the time to try to figure out what to do. It should be planned and studied. So one part of sports medicine is pre-game preparation, a little different than other parts of medicine. So also you have to understand if an athlete is unconscious, you must assume their neck is broken until proven otherwise. So when you see injury on the field or physicians peering over an athlete or a certified athletic trainer, that's the decision. Conscious or unconscious, head injury or not head injury, is there an associated cervical spine injury? That's what's going through our mind. It's done by rote almost because we practice and practice and practice for this. So that's the immediate decision. And once you're out there, you have to decide what to do. And you will see a systematic evaluation of an athlete on the field. And what that's done for, are they breathing? Can they move? Are they conscious? Do they have a head injury or neck injury? Because you must make a determination, once again, a little different than some other aspects, what to do. And you have two choices. You go to the sideline or the dugout, or you go to the hospital. Big decision. And that's, once again, done in the public theater. If you choose to go to the sideline, then you can make some other decisions which help you take care of your athlete. On the sideline, even though it's noisy and there's a lot of distractions, you can do a more detailed history and physical, and you can try to garner more information. What are you looking for? We pay particular attention to certain things. It turns out that amnesia is a better prognosticator of how someone will do with a sports concussion than brief loss of consciousness. So the athlete who keeps saying, what happened, what happened, what happened, they cannot lay down new memory, called post-traumatic amnesia, or the athlete who can't remember what happened. I remember an athlete saying to me, did I fumble the ball? And I said, no, not on the play where you got your concussion. And he looked at me and said, have I been in any other place? He couldn't remember the game. So amnesia has prognostic significance. But you know what? There's a lot of symptoms of brain injury, of concussion, and here's listed for you in some major categories. Everybody thinks of concussion as being dazed, confused, in a fog, and that truly does happen many times, but not all the time. Some people don't have that. They'll complain more of dizziness, headache, fatigue. Some people's personalities change. One of our players who was one of the most sort of irritating human beings I've ever met. He was the kind of guy who we used to say would pick a fight with an anvil. Tapped me on the shoulder during game and said, excuse me, sir, I think something's wrong with me. And his presentation of his concussion was it changed his personality, and you have to know your players. You have to know their baseline so you can identify their brain injury. Unfortunately, he got better. Just kidding. So when you're on the sideline, see, you know, Dr. O'Kane and I don't get, you know, we have the best seat and the worst seat in the house because we're working during the game. So when you're on the sideline, the game goes away, and then one of your associates watches the field, and you have to make decisions with this athlete. You can never leave the athlete alone because these are, and this is an injury which you need to watch to make sure it doesn't progress. So you never leave the athlete unsupervised. And once again, you have to make determinations. Do they go back in the game? Do you send them home? Or are you more worried and you send them to the hospital? So your work continues off the field of play. And then you also have responsibility to tell people who are going to care for that athlete what to do. No alcohol, no anti-inflammatory medication. Make sure you follow up. It's not the time to be physically active. So part of your job as a team physician in managing brain injury on the sideline is to complete the job, the on-the-field piece and the sideline piece. One of the most controversial things and the hardest things for team physicians to do is decide who's had a concussion if they can go back in the same game. Tough, tough, tough decision. There's pretty general agreement that if athletes aren't getting better, they don't go back in. That's the easy part. If they don't clear, it's pretty easy. However, for those athletes who do clear, there's controversy, and this is one of the controversies in sports medicine. Who goes in? Some people think that certain symptoms, even if they get better, you're done. So if you had any loss of consciousness, you're out. If you had any amnesia, you're out. Some people say yes, some say no. The evidence is unclear. This makes it challenging because you want to protect the athlete, and as the athlete, believe me, wants to play. Any of those who are athletes yourself or have kids athletes, you understand that. But if you're going to put someone back in the same day, you have to understand certain things. Younger athletes don't recover as quickly. 25% of high school football players who have a concussion still have symptoms 4 weeks later. That is not the case in older athletes. For those of you who have children in sports or yourself are involved in coaching, particularly at the middle school and high school level, there is no question that you don't get in trouble if the athlete doesn't go back in. So without a doubt, the safest course is to hold the athlete out. The saying is, when in doubt, sit them out. So if I can teach you two things tonight. Number one, you don't have to have loss of consciousness to have a concussion. And secondly, if you have a young athlete and there's any question, don't put them back in. After the game, you've made that decision, you've made it through the game, you have post-game day questions. You're not done yet. Then it's your responsibility to find out more comprehensively about this concussion and also any previous concussions. Makes you decide whether you need to get help from specialists, whether you need to do further tests. And once again, though, for Dr. O'Kane or myself, the athletes in the training room, it's now Tuesday, you still have to make the determination. It's a go, no go. You cannot play, you cannot practice, you can practice. So those decisions remain in your purview. It's important for those of us who manage brain injury to understand certain things. Once again, brief loss of consciousness really isn't very predictive about how an athlete will do. It doesn't look good at first. There's immediate symptoms. But you know, an athlete who loses consciousness for 1 or 2 seconds, that's not the most valuable predictor of how he or she will do. Amnesia is, as well as a number and duration of other signs and symptoms. So an athlete who has persistent amnesia, dizziness, lightheadedness, difficulty concentrating, the chance of them returning quickly is much less than someone who had simply brief loss of consciousness. Every athlete's different. I wish there was a grading scale. I wish there was someone you could look it up and say, well, this is going to be 4 days or 6 days or 10 days. The third teaching point, besides loss of consciousness and sitting young athletes out, is it's not easy to return based on a grading system because everyone's response to a brain injury is individualized. Everybody's brain is different. We manage by symptoms, not by grades. Did he have a grade 3? Did he have a grade 2? Frequently asked by the press or in the paper, that is not as relevant as to the individual symptoms, how many, how long, and how severe. However, when you look in the literature, which now since you're going to be doctors in about 45 minutes, I know you're going to do regularly, there's many return to play guidelines, but many of them are based on brief loss of consciousness, not on other symptoms, so guidelines may be less valuable in making decisions than individual assessment and management. Teaching point. There are many factors that doctors like Dr. O'Kane have to think about when an athlete comes in who's had a concussion. How bad was this concussion? How many previous concussions? How many, how severe, and how close to this one? Was this a bad concussion secondary to a minor blow? See athletes who, after 2 or 3 concussions, will simply bump helmets with another player and they have a concussion. That's a poor prognostic sign. As we've said, age, there is no question that the brain in development is different than a mature brain and how it reacts to concussion. What sport are they playing? You're a little more comfortable when someone inadvertently gets hit in the head with a golf club, because the intent of golf is not to strike the other player with the clubs, except in my college fraternity apparently, but that's a different story altogether. Versus football, where the intent indeed is to collision. You know, another thing which we need to understand is athletes with learning disabilities don't do as well with brain injury. So these are the questions that need to be asked after the fact. This is how a good sports medicine physician does his or her job. Can I make a decision about who goes back to play? Not the same day, but you waited a while, you've done your work. The athlete absolutely must have no symptoms at rest before you do any physical exertion. Just so you know, if you try to exercise, or for that matter, if you try to do cognitive activities such as studying when you have a concussion, it prolongs your recovery. It actually prolongs your recovery. Once you're symptom-free, Dr. O'Kane doesn't say, okay, you're good to go. What he does is he challenges that person over a course of several days with aerobic challenges and weightlifting challenges to see if, when we increase your metabolic demand and your intracranial pressure, your symptoms stay away. So progressive return to activity, if you make the decision they're not going to go back the same day, is the way to go. Symptom-free first, then progressive return to activity only is tolerated. An exercise challenge, you wait that day and see if the patient gets symptoms. If not, then you push a little harder the next day. Talking days, not hours. This is a 4 to 5 day process, not a 1 to 2 day process. Why all this fuss? Why all this fuss about doing this, particularly for younger athletes? There's this thing that people talk about called second impact syndrome. Some people don't believe it exists, other people believe it does. And this is a rare thing, and it's limited to teenagers, adolescent athletes. Never been seen in the NFL or Major League Baseball or in the National Hockey League. It has been seen in boxing, but it's a little different deal. And we worry about this, particularly in young athletes. And what happens here is someone in the medical field witnesses the first concussion, so you know there's been a concussion. The player doesn't become symptom-free and goes back to play. This happens more than you might realize. And then there's a second event, another concussion, and there's rapid deterioration. Most of these players drop and die. And it's not due to blood in the brain or a fracture. This is due to autoregulation problems. The brain begins to swell uncontrollably. And this is discussed. Some people believe it does exist. Some people believe it doesn't. I'd like to share a little story with you here. A patient that I had the privilege of taking care of who has made it his business now to talk about. This is a young man named Brandon. And when this video was shot, Brandon, I think, was 15.
Just like as if the ball was there. Now give me your real swing. Dress the ball now, like you're really going to hit it.
Brandon, is your life any different this fall because you went to the youth gathering in Missoula? I mean, would you be doing things any differently now if you hadn't gone?
I don't know. I don't really think so. I don't think I'd be doing much different. I like to think I'm a pretty good kid.
Okay, so you were pretty good before you went, and you were pretty good when you got back.
Brandon was 15 when this video was shot, and he was a football player at his school, and he hit another player, didn't lose consciousness, and had a pretty bad headache and felt nauseated. Matter of fact, he wrote a note to his dad saying, "I have the worst headache of my life." Went to school the next day, was sent home because he couldn't do his schoolwork. Kind of laid around the house, tried to go to school 2 or 3 more times, and just didn't feel right, confused a little bit, nauseated, dizzy, lightheaded. 6 or 7 days after that, he came back and played for his team. It's unclear if he was ever really symptom-free, but he certainly wasn't at 6 days, and he played that 7th day. Brandon's mom is videotaping the game at Brandon's number 61. This is the last play of the first half.
2 eyes, Mom.
Get him, Brandon. Brandon just got him.
Pretty
Did you
much
get him when he made the tackle?
a nothing play, minor tackle, no major trauma here. Half is over. The players go to each end zone and huddle up before the second half. Brandon's having some trouble getting up after that tackle, but he does get up. Help from his coaches. I mean, this is 7 days after his first concussion.
Mama, stop. Now, can I see Mama? Stop now. Mama, stop now. Can I see Mom?
In a minute, Brandon.
I'm not Brandon.
Brandon's little brother. Brandon comes out of the huddle. He really is feeling poorly now. And this is Brandon's mother videotaping her son being unresponsive on the football field. Now, thanks to the institution where Dr. Foy works, Harborview, Brandon was airlifted to Harborview and he was saved. When burr holes were drilled into his head, his brain tissue just herniated out through those burr holes because of the amount of severe cerebral swelling. I do think this is a second impact syndrome. Preventable. Brandon did live. He's become a spokesperson for the CDC. This is Brandon today, though.
My life is extremely different. It's different in every way, shape, form. I don't know how to explain it, because I still think of myself as that same guy. Even though I'm not, and I know I'm not, I still think of myself as him.
Tough stuff. Preventable. It's the second impact. So when youth athletes, when in doubt, sit them out. This is not common, it's rare, but I think it's relevant because it's so devastating. And Brandon's gone on to become a spokesperson for the CDC to try to prevent this from happening to other athletes. While this is unusual, there are more common concerns that we still worry about after people have had a concussion. Once you've had one, statistically, you're 2 to 4 times more likely to have a second one. Maybe that's because of the way your brain is put together. Maybe that's because of the risk you take by playing. But you need to inform players of this fact. People talk about post-concussive syndrome, persistent cognitive impairment, dizziness, light sensitivity, irritability. Maybe 5 to 8% of people who have had multiple mild traumatic brain injuries have been diagnosed with this. This is a concern. And cumulative brain trauma. How many of those, how many of you have read these articles in the New York Times and other about these players, former football players who have had serious problems in their 40s? I'm not talking about boxers now. I'm talking about the football players. Okay? The Andre Waters story, or the Justin Strelzik story, or the Terry Long story, or maybe the Mike Webster story, or most recently Chris Benoit. All deaths, all in their 40s, all due to trauma to their brain, proven by autopsy. Very concerning. Very, very concerning. But you know what? There's a whole lot of people who have played a whole lot of collision sports who don't have this happen to them. But one of the things, I guess one of the more daunting things, is to try to sort out or stratify this risk. Why does this happen to these players? It doesn't happen to the great majority of players, but it does worry me when a young athlete's had 4 or 5 or 6 concussions. It appears that what happens for these people with these awful outcomes are multiple concussions and maybe multiple sub-concussions they don't report. Very close together. They never clear. We're not sure if there's some special mechanism or not. There's probably some sort of genetic predisposition. Why do I tell you this on your graduation night? To tell you that something which is usually recoverable, and a lot of people have had mild traumatic brain injuries and do just fine, but you know what? If you have them over and over, and if you have them close together, and if you don't recover from them, this may be a different disease. That is the controversy surrounding this injury in sport. Attribution of bravery for a concussion is the wrong way to go. Look how tough he is. He got right back up and came into the game. Doesn't help you here. It's a culture that we need to change. To conclude this, if you are involved with someone who has a concussion, they should be taken out of practice or play. Never leave them alone. They should always have a medical evaluation. This is one time where they need to see someone who understands concussion. A certified athletic trainer is a great advocate here. It's a great advocate and perhaps the most important piece of this. And return to play should be in a medically supervised, stepwise, progressive fashion. And you need to be well before you go back to play. That's sort of my take-home message for tonight. No question about it, the younger the athlete, the more conservative the treatment. I wish there was a simple test. Use signs and symptoms, not a grade 3, not a grade 2, that doesn't help me very much. Signs and symptoms, how severe, how long to recover, how frequent. And the onus is upon all of you soon-to-be doctors now that the clinical judgment is a final return-to-play decision, not some protocol. There are a lot of resources for this. The Center for Disease Control has wonderful free concussion kits for coaches, athletic directors, and for parents and athletes as well. And I think this is a good room to make this announcement. I am happy to tell you as the first public announcement that the Seattle Seahawks and the Brain Injury Association of Washington are going to partner, and you will see a statewide concussion awareness program for young athletes. And that will include public service announcements, educational material for coaches, outreach programs at the schools, and a variety of other ways so that we can hope that there will be no more Brandon Schultz stories. And of all the years I've been in practice, I'm most excited about this as about anything I can remember. So look forward to maybe reaching out publicly and seeing if we can keep sports safe and at the same time protect our athletes and let them compete. Thank you very much for your attention. I have a little bit of I think a way to make this personal and inappropriate. If you remember when we started off my lecture, I don't know if you want to watch this again or not, but if you think it's hard for you to watch, and maybe even harder for the athlete to whom it happened and for her mother to watch. And we have the real privilege tonight of an athlete willing to come forward with her family and talk about what a mild traumatic brain injury in sport is all about. So I want to introduce you to Allie Strite and her mother, Kathy. Come on up. This is a family that knows me way too well. And they were, you learn a lot from your patients, and you guys are very generous, and we thought that we would let them answer some questions rather than hear it from the physicians about brain injury in sport. And if you have questions for them, or then maybe Dr. O'Kane and I can take questions later about our lectures in general. But, you know, Allie is a senior now, and her high school basketball team took 5th in state. And I understand that she was the leading scorer for the last game of the playoffs. Which is remarkable if you know her story. Now, as I said, Allie never lost consciousness with that concussion. She never passed out. And if I remember correctly, Allie, did your coach not put you back in the same game?
Well, I did go back in. I sat out for a while, but I went back in for probably the last quarter about.
And did you not, if I remember correctly, since you're such a good athlete, didn't you try to play the varsity game that evening as well?
Yeah, I warmed up with them, but wasn't able to go in for any of the game at all.
So the first teaching point is certainly when in doubt, sit them out didn't work here. There was no medical evaluation, and Allie, as many athletes, made the decision to go back in. Can you remember, Allie, what the first few days were like?
Well, the first day after, I know that I was very sensitive to light, and I was just very out of it, and I had constant headaches, and it was just hard for me to just concentrate on anything, and it was just I don't know, frustrating, I guess. So
that was the first day. I didn't see Allie for 6 weeks after this concussion, and I would like to point out that it was a certified athletic trainer who actually made the suggestion, just to show you the team piece. Do you remember those first, I mean, 1 day is bad, but anybody can take a headache for 1 day. How about 1 week, 2 weeks? Can you remember
It was really, the headaches continued and they like never really stopped. And I like didn't eat much for the first, I don't know, few weeks or so. Like I didn't have appetite at all. And I just was really out of it. Like my family just realized that like they'd tell me something, but I could not remember it. And like I'd keep asking them.
Were you trying to go to school at this time?
Yeah, but I just could not focus in classes and just my grades dropped like so quickly.
When I saw Allie, she was previously you were an A student, and by 4 to 6 weeks your grades were where?
Pretty much failing almost.
Big consequence from a sports injury. When I first met Allie and her mom 6 weeks after, Allie looked sleepy to me, like my kids look when I'm trying to talk to them. You know, how do you feel? Worse than usual. And she looked sleepy, but you know, when I asked Allie certain things, like, could she repeat 4 numbers back to me? This is a high school sentence. Can you repeat 6, 7, 2, 9 back to me? And there was no way that was happening. 6 weeks after her concussion. Do you remember that first visit? Probably not much.
No.
This was 2005. That was 6 weeks later. I remember the spring of that year. Did you take driver's ed?
No.
Couldn't do it. Did you pass school that quarter or semester?
Barely. It was hard, but I did.
Were you able to do anything at all? Can you remember about how can you tell the audience, let's pick, you know, April or May, how your day was at that time?
Well, I was very sleepy, and like in classes I barely did anything. Like I couldn't concentrate, and teachers would always be trying to like talk to me, but like I just didn't want to do anything. And like I couldn't do sports at all, so that like made me really mad because like I always was active and doing things, and then all of a sudden I couldn't do anything. So I just got really frustrated, and everything just got worse, and I just didn't want to do anything. I got really tired and was like always sleeping. So.
Different than you were before in terms of your anger, personality, mood?
Yeah, I was very angry. Mostly towards my family, just because they were the ones like holding me back from doing things. A lot towards my mom.
Actually, it was me, but her mom was responsible,
Yeah.
so I got to see her for a half an hour once a month, and then she had to go home and live with the consequences. Sports a big part of your life?
Huge part. I played since I was in like first grade.
And that's the burden, of course, is it's never the kids on the chess team that get a concussion. It's always the kids who play sports. I remember, Allie, it was well into the summer. Can you remember the first time you didn't feel a headache or tired or dizzy? Can you remember the first time that happened after February of 2005?
Not really. Probably July.
Yeah, July. No loss of consciousness. July. First concussion ever, right?
Mm-hmm.
Good student, no learning disabilities. Big blow. You've seen the blow twice now. You were a very good sport. You watched that twice tonight. And Kathy, Allie's mom, brought that videotape into me. Remember what I told you? So I'm going to make you famous. Do you remember that? And tonight it is. I remember, Allie, even in July, we tried to do some simple exercise. Do you remember that?
Kind of.
Jogging,
Oh,
just riding a
yeah,
stationary
yeah.
bicycle a little bit.
Mm-hmm.
It didn't go very well. The initial phase, even after waiting 4.5 or 5 months, really even trying early initial exercise, the gradual return to activity we talked about didn't go very well. Do you remember the testing that I had you do? That awful all-day testing?
Oh, yeah.
Neuropsychological testing is something which is kind of big in sports psychology, or in sports medicine now, in concussion. And this is very detailed testing where you can look at thinking, verbal fluency, memory in a much more detailed fashion than I can do by asking questions. In professional football, we do baseline testing, so we know what the player's baseline is before an injury, and we can use that as one measure for return to play, not the only measure. In Allie's case, we did not have baseline testing because it's not done on, 15-year-old high school basketball stars. But we did do some post-concussion testing, and we did it sequentially. And Allie was an A student. And I remember being struck specifically by one test called the Hopkins Verbal Learning Trial are. It doesn't matter what it's called, but it's a test that looks for verbal memory and fluency. And Allie, the A student, the first time we did that test, I don't know if I've ever told you this, your grade was in the bottom 1 percentile. And that was done over 2 months after her concussion. And this is an athlete who's trying to go to school. When we did it a few months later, it was in the upper 2/3. So there's truly cognitive injury or dysfunction that takes time to recover. Your grades now?
Back to where they used to be, 3.6.
How long did that take, though?
Probably till at least last year. About last year, I got back to normal, I think.
So a ding is not always a ding. It's not always a ding. We held you out for how long? Forever, it seems. I know.
Yeah, 9 months.
9 months. And even making that decision, and I remember this visit being fraught with some emotion about, do you let this young athlete go back to sports at all? How about never? Never was on the table here. Maybe not on your table, but your mom and I were looking over your shoulder going, I don't know what we should do here. So what compromise did we do? Do you remember?
Not really.
Basketball, no volleyball.
Yeah.
We picked one sport where we thought the chance was less. And the other thing that we did is take our time and watch you carefully. And people say it's fun to be a team doctor. And let me tell you something. I will speak for myself, and I suspect for Kathy, you never watch a basketball game the same way again. It changes you forever. I mean, I am the happiest guy in the world when the game is over. I don't even care who wins anymore, as long as everybody walks off the field. So I want Dr. O'Kane to chip in and ask Kathy some questions, but I think this is instructive. This is something which was a serious injury for a young athlete who was put back in the same contest and then tried to put in the next game. As a matter of fact, when I first saw you, you'd already seen a doctor, and they said, well, just wait a week and make sure you're okay. And this was, life-changing. She's back. She's making good grades, playing great sports, and her future is bright. But to this day, here going forward, her chance of having another concussion is higher than someone else's. No matter what happens, time doesn't erase that. So a great story and a great athlete and a great young person. But it was challenging, and I would like to compliment you on your maturity, at least in my office. You're a very good sport about a very bad injury.
Thank you.
Kathy, I'm curious. I'm a parent, and many of us here are parents, and we all know how we feel about our kids. What was this like for you? Her experience appears to be headaches, a lot of fogginess, a lot of memories that really weren't being put together, but you were the witness. And for better or worse, you remember it very clearly. I wonder what it was like for you.
Well, it was very devastating. For one, not having anybody out there to help us, to know, is this normal or not? And it was just tough because she got angry very quickly over it because she got everything taken away from her. And she was not the same person that she used to be. She lost friends over it. Her friends just stopped talking to her. And she was alone all the time. She cried a lot. She just wasn't the same person that she used to be. So every day it hurt me. I couldn't wait till she got home from school to see how she was doing. She usually went to bed right away because she wanted to sleep. That's all she ever wanted to do.
What was the level of understanding at the school about what was going on with her, and what was their interest or ability to accommodate that at all?
Well, her teachers, I had to keep telling them constantly about her injury, even though I had paperwork from Dr. Herring and stuff, they would forget. So it was a kind of a fight for us to, keep her on the right track and keep her going and have them understanding of her injury. A lot of people just don't understand head injuries, and it just made it difficult for us. So.
Did it seem, Dr. Herring mentioned earlier in his lecture that trying to exert yourself too soon or trying to really exert your brain to think too quickly after an injury like this really does prolong your symptoms? And I'm really impressed with Allie because what I took from this is that you can have a recall of less than 3 numbers and score on the bottom 1% on verbal fluency and still pass. So, I mean, you couldn't get out of many medical school with that. But I mean, what that's telling me is she was putting forth some fairly extraordinary effort despite great frustration. Although I wonder if that was, in your experience, did it seem that was actually hurting her? Was it tougher when she got home from school when she was facing these obstacles? You can answer this as well. Did your headache get worse when you sat there in algebra trying to figure out what was going on?
Yeah, definitely. I always had to take breaks. I think my mom remembers, like, I'd try and do it, but I get so frustrated because, like, I got the worst headache, and then I just had to stop. And it just kept getting worse if I tried to, like, work harder at it, so.
It took like 3 times as long as it used to do homework once that concussion happened. I mean, it was all night. And she was a very motivated student, and she didn't even want to do homework. So
6 weeks went by before you saw Dr. Herring, yet you were going to school. What was happening with your sports then? What were your coaches? What information did your coaches have? What were you doing in regards to basketball? And
Well, basketball had just ended, so, like, I stopped doing that. But then I started to, like, slowly participate in track, but I wasn't doing, like, that much, just, like, a few, like, running events, and that's it. But I didn't do any meets, but I just, like, he told me I could, like, run, but I couldn't do any, like, contact sports. Like my doctor, I think that's what the doctor said.
So you were out there running. How did you feel out there running?
Well, I don't know. I think I was just, like, I was so out of it, like, I didn't really know, like, I was just wasn't into, like, what I was doing, so I had no idea.
Was there anybody available to talk to about how you were feeling?
Well,
like coaches or an athletic trainer, or was there somebody in a position that you could go to help to have you say, I'm feeling horrible and I'm not even sure where I'm going?
yeah, I just didn't, like, I don't know, I was just really confused, so I didn't think it was that big a deal. I thought I'd be fine, and so I had no idea.
plus, even when she's healthy, she doesn't communicate to this trainer very well, right?
Yeah. What should we take away? What should we take away from this experience? Dr. Herring made a very impressive announcement about an effort to increase awareness of concussion in this state that's being undertaken. What do we need to do? How the injury occurred, and sometimes injuries occur, and then you have to deal with the aftermath. But what could have happened that would have just made this a lot easier for you guys?
Well, first off, it would have been nice that they did not put Allie back in a game. Ever since this happened, when I see anybody get their head hit, I just say, don't you dare put them back, There needs to be an awareness for that.
Yeah, I think in the classroom, when we have a college athlete that has a concussion, we let the academic people know right away, and the academic tutors talk to the teachers, and they understand that this person is not able to function normally cognitively. It seems like that's a message that in this situation that really needs to get to the high school teachers so they understand. I can't imagine the frustration of being an A student, finding yourself in class, taking tests, getting Fs, and just sitting there going, I don't know, this is the best I can do.
Yeah.
I don't know. One of my teachers had my mom call her because she didn't believe me that, like, I had a concussion. So my mom had to call her and tell her that I could not participate in, like, gym because I had a concussion.
Yeah, it's misunderstood, and the consequences, I think, are often, I guess maybe the point that Kathy has said to me is that frustration on the parents' part about feeling isolated and alone, and is this only my daughter, and when she's going to get better, and the school being is somewhat supportive but needing consistent reminders. And I think it is really a source of frustration. And of course, this dangerous issue. During that whole time where Allie was put back in to play the basketball game or she was running track, she was really at huge risk. And I think that's the sobering point that Kathy and I talked about, was there was this period where there was unnecessary risk being taken for her to really have significant or permanent sequelae. And the awareness piece and then the understanding of the timeline is really important. I think it's so critical to realize that it was, I remember the day because it was the 2nd of July and you guys came in for a visit and you said to me, I think I have my daughter back, because she was starting to wake up, and that's a good day. That's a good day in the doctor business right there, when a patient can get well and you can take credit for it. What better possibility could there be for that? And it's very satisfying to see that, but I think that there are many pitfalls along the way, and if we can leave with one message, or maybe you have questions for Allie or Kathy directly, the message is recognition, early management, and understanding that this really has consequences in both the athletic and in the academic arena. And when Allie tells you that she was unhappy because she can't play sports, you must understand the psyche of the athlete. You were really unhappy because you couldn't play sports, because that's who she is. That is who she is. That was her identity. And a concussion took it away from her. But you're back.
And your job at that time was to protect her from herself.
From herself.
Yeah.
That's exactly right. And I had great support from her mom, but that was my job. Are there questions for Kathy or Allie? Maybe you should come to the microphone, I've been told, if you want to.
Thank you. I have 2 questions. Are medications helpful for this condition?
No. How's that for an answer? Not really. They do not shorten the period of recovery, and they can treat things symptomatically, but then you're running the risk of giving someone pain medicines, for example, who already has impaired cognitive status, and it actually sometimes is counterproductive. There is no great medical management or any other management, just time is the answer here.
And question number 2, would wearing helmets be helpful for high school basketball players?
The question of is wearing helmets helpful? Let me ask you, for those of you who are students of sports history, when football first started, they didn't have helmets, right? And so what was the biggest injury in football? What was the biggest head injury? Skull fractures. Okay. Then we got smart and decided we're going to have a rigid plastic helmet. Since there's been a rigid plastic helmet, there have been no skull fractures. What have there been? Concussions. We made the head a weapon. And so certainly putting a helmet on a basketball player may not decrease the chance of concussion. It may make the players a little more aggressive. And even in helmets, certain people get concussions. So the same thing with a soccer protective headgear or wearing helmets for those sports probably is not a solution to preventing mild traumatic brain injury. As a matter of fact, ironically, it may increase the chance for mild traumatic brain injury.
I was wondering if you had any problems with your teachers thinking that maybe you were on drugs or maybe you were just faking things.
No, not really. I don't think so.
Although it would be, people make decisions based on pattern recognition, and if you see a student's performance drop off and they become sleepy in class and disorganized and surly, you got to believe that would come up. Once again, the awareness campaign at the school level is critical. It's a great question.
Hi, I had a twofold question about the nature of sleep in the repair of the brain. Because I understand within the first 12 hours or something like that, you're not supposed to let the patient fall asleep for a long period of time. And yet I'm wondering, since she obviously needed to sleep a lot to heal, and you said that actually stressing your brain by thought and going to school actually damages the recovery, should she not have just stayed home from school and taken a leave of absence to speed up her recovery?
It's a great question. John, I don't know if you want to speak to that. I can speak to it, or John can speak to that.
What do you think? Should you have just stayed home from school and rested? Would that have been a better situation?
In some ways, I think so, yeah.
Yeah, if you had just had ACL surgery, no one would have questioned your decision to stay home for a week and recover, because that's a knee sprain. A brain sprain, you know, it's only your brain. It's an interesting paradox. I think that, you know, that really needs more awareness. The comment about, you know, when people have concussions, I had a concussion in high school, and my mother was told she had to wake me up every hour all night long. And by the end of the evening, she was exhausted, I was exhausted, and I think she knew I was getting better when I finally said, "Mom, please just leave me alone, let me sleep." We don't tell people to do that anymore. I like to make sure that if we have an athlete with a concussion, we give them the advice that Dr. Herring was discussing regarding no alcohol. I just want you to go home and rest. And I make sure their roommate is aware of it, so the roommate can keep an eye on them in case they were to decompensate quickly, in case they did have a slow bleed in their brain. Now we're talking about a different problem than mild traumatic brain injury, but if something like that were to develop, you want someone around who can help out. Often they'll go home with their parents that night in my situation, but we don't tell people to wake them up every hour anymore. So.
If you read the literature from Shock Doctor, for example, you know, they tout how well their mouth guards help prevent concussions. I assume that you weren't wearing a mouth guard while you were playing basketball there, but do mouth guards really help prevent concussion, especially from the type of fall that we saw there where the head actually hit the basketball court?
Were you wearing a mouth guard? She was wearing a mouth guard. She was wearing a mouth guard. That worked pretty well.
I guess that answered the
question. It's a very good question you asked. Well, there's a lot of discussion about, you know, a mouth guard preventing concussion, particularly in football. There is no evidence of efficacy. Mouth guards prevent dental injuries. So Allie had a concussion, but she didn't lose her three of her front, you know, teeth. I mean, she had a concussion, but once again, if you think you can buy yourself a warranty that if you put a mouth guard in, you won't get a concussion playing football, that's just not true. It's a great question.